Well, first though, the strain Omicron is putting on the healthcare system across this country. Hospitalizations are rising, and those trained to treat patients are being sidelined in overwhelming numbers. In New Brunswick, 347 healthcare workers are isolating, forcing that province to put out a call for volunteers. 113 people are in hospital right now due to COVID-19 in that province. That is up from 25 just a week ago. 15 COVID-19 patients are in intensive care right now. That's up by one in the span of a week. Dorothy Shephard is New Brunswick's health minister. She's in St. John. Minister Shephard, thanks so much for joining us.
It's a pleasure to be here. Thank you.
Your province is at a point where you need to call for volunteers to help staff the healthcare system there. How did you get to this point?
Well, it's twofold, really. First, we've had a number of people come forward to say they want to help. And we needed to put in a mechanism in place by which to vet all of those offers and to try to utilize people where we need them most. Secondly, it's no secret, as every other province has experienced, the health human resources that are that are unable to come to work because of being COVID infected, is starting to outweigh the need. So what we're doing today is we put out a call for clinical and non-clinical individuals to come forward, let us know their skill set, and we're going to try to utilize every single one of them.
How many people are you looking for, do you think?
We really haven't put a number to it. What we're looking for is to find that, to give that mechanism by which people can come forward to offer their help. And I've had many people, approach me. I know the Premier has as well. And so it's really important that we take New Brunswickers up on this offer, because that's what they're good at. They always come through for us when we need them.
What kind of people? Who is offering help? Who's reached out to you?
So what I've been, personal support workers who are actually only working part-time are looking to offer support in other areas. There are non-clinical people, like people who have worked in hospital administration and areas that they know that they can offer support. People who may have worked in admin and either retired or left work when they got a family. So it's many people from many different avenues, and we want to take them up on their offer.
What areas do you have the highest need in right now in your healthcare system?
Well, we're asking for clinical and non-clinical individuals, and so clinical, it would be perhaps retired RNs or LPNs. We would have anyone who can administer vaccinations. So that could be, anyone from pharmacy or dentists, any of those professions who could come forward, physiotherapists. We would be happy to have them come on board, and we'll find places to utilize their skill sets. But also, people who know how to do administration work, who could maybe offer to do screening, who can help direct traffic at vaccination clinics. There's a need for many different places that we could utilize them.
What kind of vetting process will there be?
Well, there's an application process, and then we will put people on this. But the vetting process will obviously be to understand the skill set and where we can most aptly use them.
The press release does note that there is paid and unpaid work. You mentioned it as well. How will you divide what is going to be paid and what is going to be unpaid?
Well, I think it will depend on on skill sets and how they match into areas of need. And I think that, as always, there are jobs that could be filled with, with people who just want to volunteer to help. We have lots of people who haven't been able to volunteer their skills since the pandemic began. And so again, it will be triaged and we'll utilize everyone to the best of their ability.
It is very lovely that people are very Canadian, that people are coming forward and offering to help in any way that they can. But it is still an extraordinary situation that this is where we're at in the pandemic in your province and others as well. Why should anyone, however nice they may be doing free work for the province in this capacity, in this critical capacity?
Well, I think it's quite known that Canadians, and in particularly, I'll say New Brunswickers, have always stepped forward to help in times of crisis. And I think that we know that there are many people who spend their entire week doing nothing but volunteering, and they get a great deal of personal satisfaction and benefit from it. So look, we don't want to take advantage of anyone. We will certainly look to the skill sets and try to use everyone where we can. But we know that New Brunswickers want to help. And so we're giving them a mechanism by which they can offer.
Knowing where you're at right now, seeing how folks in the healthcare system are struggling, the staffing issues, what have you and your government learned about what you want to do differently to help support the healthcare system in a post-pandemic world?
Well, first off, stability in our healthcare system is paramount, and we've tabled our healthcare plan, and we plan on executing on as many of those initiatives as soon as possible. And indeed, much of the work has continued all through COVID. And so I think that we've addressed many things, including out-of-date contracts, labor contracts that have all been settled and moved forward with. And I think that on the whole, we have the ability in New Brunswick to have a network of health excellence that could be unequaled. And I've made it very clear that employee satisfaction is paramount. We need to ensure that our people know how much we value them, and they also need to know that their future is here.
Something that could help your healthcare system and those across the country is what we were reporting on yesterday, the approval by Health Canada of Pfizer's antiviral treatment, Paxlovid. Wanted to ask you about that now, Minister. How many courses of treatment is New Brunswick going to get?
So we're getting 700, which, when you're looking at 12 or 1,500 cases a day, is a tool in our toolbox for utilizing with public health priority list. And so we're going to be using what we can. The antiviral is the next thing with our COVID fight. But we know with the small amounts that we're getting, and as the federal government ramps up their supply, which will take some time, this is a tool in our toolbox. And the very best course of protection against COVID and variants is vaccinations. And we want to encourage everyone to continue to get their boosters. When
do you expect to get the antiviral shipments that you're promised?
I believe we will have this weekend.
Okay, we'll be reporting on that, I'm sure, our colleagues out in New Brunswick. And who will you be prioritizing? How do you plan to roll them out once you receive them? Well,
Health Canada and Public Health New Brunswick are certainly utilizing expert advice. Right now, I can tell you that we'll be 80 plus and immunocompromised individuals for the most part. 700 doses is a really good start, but with the number of cases that are escalating, it's kind of like spitting on a house fire. So we're going to have to be prudent.
How many people will that many courses help?
Well, they are 700 treatment courses. So it will be utilized up to 700 individuals.
Premier Higgs has said, as you know, that he is determined to see students in your province back for in-person learning in schools as of January 31st. But only about 52% of children in your province between the ages of 5 and 11 have even received just a first dose. So that's far behind Nova Scotia, as well as Newfoundland and Labrador. How much of a concern is that to you, Minister?
Well, second doses are coming up about now. Again, though, we want as many of our children vaccinated as possible. And so we continue to push for that. We have the appointments that are there, and we're asking parents to get online or get on the phone and book their children at their local pharmacies. We have many ready to take those appointments.
What else are you doing? What else is the government doing to try to boost those vaccination rates, not just among children? I mean, you mentioned that the antiviral is one part of the process, but people still need to get vaccinated. So what else are you doing?
Vaccination is the best course of defense against COVID and the variants. And so we've escalated our vaccination clinics. We started off, we were able to do about 42,000 in a week. And now we'll be pushing those over the next week and a half, up to 80,000 doses a week. So we're doing everything we can to make vaccination accessible, convenient, and there for people when they're ready to book their appointments. And so we continue to encourage. This is the best defense against COVID.
Minister Shephard, thanks so much for your time.
I appreciate it. Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.